Hello, welcome to my YouTube channel. Today we're going to talk about a very high yield topic which is frequently tested on the board exams. And I'll give you some solid information how to tackle a USMLE style question and how to augment your score in the optimal way. So let's get started. So this is a 42 years old woman who is visiting the physician because of 1 day history of severe pain and swelling and warmth in the left knee. The pain is moderately relieved by ibuprofen use. She notes that she awoke with pain 1 day after she did an aerobic kickboxing workout. Her temperature is fine and she is vitally stable, but examination shows that on the upper aspect of the left knee, there is erythema and the area is warm to touch, and there is an effusion around the knee joint. Range of motion is limited because of the pain. The rest of the physical examination is fine. Which of the following is the most appropriate next step in the management? So this clinical vignette, this topic is very important and highly tested on step 1, step 2, and step 3. And it is really important to know the difference between the various presentation and how to manage it. So let's get started. So which of the following is the most appropriate next step in the management? So we can say that arthrocentesis is basically is the right answer, and it should be the next step in the management. So why it is arthrocentesis and not the rest of the options? So let's walk through the clinical vignette. So this patient who is a middle-aged lady, and 1 day history, very short history, sudden onset of pain associated with warmth, tenderness, and there is redness associated with involved area, and there is also effusion. So all these things, all these features points towards the gout or pseudo gout as the likely diagnosis. They have given you a history of aerobic kickboxing workout, right? So, but in this case, this sounds a distractor. Like they try to distract you uh, by giving you a hint that the patient suffered or sustained a trauma during this activity, and they want you to choose application of knee brace and eyes and leg elevation as answer, or MRI of the knees to rule out the trauma. So, but you see that if the patient sustained a trauma during this sports activity, the pain should start at the time of trauma. For example, if there is meniscal tear or injury to the menisci or anterior or posterior cruciate ligament, so the patient would be having severe pain at the same time, right? Not the day after the activity. So it is just a distractor. And so we can rule out these two options. Application of a knee brace, eyes and elevation, it can be opted for any trauma associated with knee joint, or if the trauma or if the symptoms doesn't resolve over time because by just conservative management, so you can opt for MRI of the knee, right? So you are not going to order an MRI of the knees straightforwardly, right? Straight away. You are going to uh, opt for some conservative management, and then you can opt for MRI of the knees if the patient doesn't improve. And as I told you that the symptoms and the features doesn't correlate with these things, so you can rule out these two options. And reassurance, you cannot reassure the patient because the patient is having severe pain. You cannot say it will improve on its own without knowing what is going on. And you cannot give the false hopes or false reassurance to the patient. So you can rule out this option too. So we are left with intravenous antibiotic therapy. So intravenous antibiotic therapy you are going to give in case of septic arthritis or osteomyelitis. So okay, you can see that there is erythema, there is tenderness, and there is redness. All these features points towards uh, an infectious etiology, but the patient is not having fever, and there is no history of infectious. For most of the time, osteomyelitis or septic arthritis are because of the contiguous spread of the infection. So there is no infection going on, and the patient is not having fever. Patient is afebrile. So the mostly we can think of gout and pseudo gout in this scenario. Furthermore, we have to perform arthrocentesis, even if we have to diagnose septic arthritis. So, in order to rule out septic arthritis, we have to perform arthrocentesis. We have to draw some fluid from the joint space, and we have to analyze that joint fluid. So then we can gather some valuable information. Either it is gout, it is pseudo gout, or it is because of the rheumatoid arthritis, or it is because of the septic arthritis. We can gather information based on the findings of the fluid examination, synovial fluid examination. So, in my opinion, this is pseudo gout because pseudo gout mostly involves the knee joint, right? And all of sudden presentation and the features of pseudo gout and gout, they resemble a lot. And like you have to differentiate between these two clinical entities on the basis of joint involvement. Pseudo gout is going to involve knee joint mostly, and gout is going to involve the first metatarsophalangeal joint, which is the great toe or big toe, so which is also known as podagra. So gout is going to involve the great toe, and pseudo gout is going to involve knee joint. And if you perform the arthrocentesis, so on arthrocentesis, you're going to have some needle-shaped crystals in case of gout, right? Needle-shaped crystals in case of gout, like this, like this. And in case of pseudo gout, you're going to have some rhomboid-shaped crystals, like this. And the pseudo gout is partially positive birefringent under polarized light, and gout is negative birefringent under polarized light. So these are two distinguishing features between gout and pseudo gout on the basis of arthrocentesis and synovial fluid examination. So we can say that this is pseudo gout, but we have to diagnose it. And how we are going to diagnose it? We're going to take out some fluid by performing arthrocentesis, and then we can examine it, and then we can reach the exact diagnosis. So in this case, arthrocentesis should be the next best step in the management. I hope you enjoyed this video. Please give this video a like, share with your friends, and subscribe to our YouTube channel. Thank you so much.